Blood pressure foods can help, but no berry, beet, or banana works like an emergency pill. The strongest results come from a repeated eating pattern, not one dramatic ingredient. Vegetables, fruit, beans, whole grains, nuts, fish, and plain dairy can support lower readings. They work best when they replace sodium-heavy foods because lowering sodium while increasing potassium changes the pressure inside blood vessels. Sodium pulls water into the bloodstream. More fluid inside the same vessel space can raise pressure against artery walls. The kidneys usually remove extra sodium, but frequent high intake can keep more water circulating. Potassium helps the kidneys send sodium into urine. It also supports normal relaxation of blood vessel walls. This sodium-potassium balance is the main mechanism behind many helpful food choices. Vegetables are the easiest place to begin because they provide potassium, fiber, and very little natural sodium. Leafy greens, tomatoes, broccoli, squash, and sweet potatoes all fit. Frozen vegetables also work when sauces and salty seasonings are absent. Fruit supports the same pattern, but its form matters. Oranges, berries, melons, kiwi, and bananas provide potassium and useful plant compounds. Whole fruit usually beats juice because chewing slows intake and preserves more fiber. Juice can still fit in a small serving, but it is easy to drink quickly. A large glass may deliver several fruits without their full structure. That makes portion size harder to notice. Beans and lentils combine potassium, magnesium, protein, and fiber. Magnesium helps regulate signals that influence muscle function and vessel tone. Their fiber improves fullness, so they can replace processed meat or oversized portions of refined starch. Canned beans remain useful, although the liquid often contains sodium. Choose lower sodium versions when available. Draining and rinsing removes some surface salt without removing the main nutrients. Whole grains help mainly through substitution. Oats, barley, brown rice, and intact whole grain bread can replace refined starches and salty breakfast foods. Their fiber also supports fullness and steadier meal portions. Plain yogurt and lower fat milk appear in the DASH eating pattern. The abbreviation DASH means Dietary Approaches to Stop Hypertension. These foods provide calcium and protein without the sodium load found in many processed cheeses. Calcium supports normal muscle contraction, including muscles that help blood vessels adjust. Sweetened yogurt can behave more like dessert, however. Compare added sugar and sodium before treating every yogurt as equal. Unsalted nuts and seeds provide magnesium, potassium, healthy fats, and texture. A small handful can replace chips or crackers. Salted versions weaken that advantage, especially when several servings disappear from a large bag. Fish can help when it replaces processed meat or fried food. Salmon, sardines, trout, and other fish provide protein and useful fats. Smoked fish, breading, and salty sauces can change the result by adding substantial sodium. A healthy food cannot cancel the rest of the meal. A banana after instant noodles does not remove their sodium. Nuts beside chips do not erase the chips. Helpful foods support blood pressure only when they displace a weaker choice. This is why adding foods and replacing foods produce different outcomes. One group adds fruit while keeping deli meat, bottled sauces, and salty snacks unchanged. Another group swaps those items for beans, fresh poultry, vegetables, and unsalted nuts. The second pattern changes the sodium load. Restaurant and packaged foods create the largest hidden challenge. Bread, cereal, tortillas, soup, dressings, and prepared chicken may contain sodium without tasting extremely salty. Small amounts repeated across several meals can exceed one obvious salty snack. Labels make this visible. Compare sodium between similar products using the same serving size. A soup or bread can look healthy while carrying twice the sodium of another option. The better choice is often within the same food category. Beets deserve a balanced explanation. They contain nitrate, which the body can convert into nitric oxide. Nitric oxide helps blood vessels widen, so beet juice may lower readings modestly in some people. The effect varies and may be temporary. Beet juice also concentrates natural sugar and can turn urine or stool red. It can support a pattern, but it cannot replace prescribed treatment or regular follow-up. Flavor does not require a sudden switch to bland food. Reduce salt in steps while using garlic, herbs, vinegar, lemon, chili, or toasted spices. Taste can adapt over time, making the lower sodium pattern easier to continue. What matters most is the direction of the whole plate. A food earns its place when it replaces something saltier, more processed, or less filling. Adding healthy foods without changing the original meal may only add calories. Check three features: sodium, food form, and the item being replaced. Those details clearly separate a useful swap from a healthy-looking addition at the same meal. Build one repeatable plate. Fill half with vegetables, add beans, fish, eggs, or fresh poultry, then choose a whole grain. Use fruit or plain yogurt when it replaces dessert rather than following dessert. Frozen vegetables, no salt added canned foods, cooked grains, and plain yogurt shorten preparation. Keep sauces separate, because one packet can contain more sodium than the main ingredients. Food choices are not the only daily influences on blood pressure. Heavy drinking can raise pressure, disrupt sleep, and add calories. Higher body weight can increase blood volume and resistance within the circulation, pushing pressure upward. The goal is gradual change through filling meals, less alcohol, and a repeatable routine, not crash dieting. Home readings then provide the practical test. Measure at similar times after sitting quietly, with your back supported and feet on the floor. Keep the cuffed arm supported near heart level. One reading can shift after caffeine, pain, exercise, stress, or a full bladder. Judge the average trend across several days. A helpful eating pattern should improve that trend over weeks, not create one impressive number. Keep medicine timing and measurement conditions stable while judging food changes. Otherwise, several moving parts can hide the cause. Record meals, sodium-heavy exceptions, alcohol, and readings in one simple log. Potassium needs a safety boundary. People with kidney disease may not remove potassium normally. Some heart and blood pressure medicines can also raise potassium, making concentrated supplements or potassium-based salt substitutes risky. Food sources are usually less concentrated than powders, but personal limits still matter. Ask your clinician before using potassium supplements or salt replacements. This is especially important after abnormal kidney or potassium tests. Diet does not explain every high reading. Sleep apnea, kidney disease, thyroid problems, pain, stress, and certain medicines can raise blood pressure. Persistent elevation deserves evaluation even when the food pattern looks excellent. A very high reading with chest pain, weakness, confusion, breathing trouble, severe headache, or vision change needs urgent assessment. Food changes act gradually. They cannot treat an emergency. Start with one swap rather than 10 fragile rules. Replace processed meat at lunch, remove one salty sauce, or prepare vegetables without seasoning packets. Repeat that change until it becomes ordinary. Then add another swap while watching the weekly average. The goal is not a perfect menu. It is a lower sodium load, more potassium-rich whole food, and a pattern you can maintain. No single food can promise normal blood pressure. Vegetables, fruit, beans, whole grains, plain dairy, nuts, seeds, and fish work best as replacements. Judge the plan by average home readings, not one number. Keep treatment stable, respect potassium limits, and seek care when readings remain high. A repeatable pattern beats a miracle claim because it changes the inputs that shape pressure every day. Medicine simplified. That's what this channel does. If you want more, hit subscribe. This is not medical advice. Consult your doctor.